Hello, my name's Gail Davison and I'm a first year PhD student at Queen's University Belfast. This is a short video to outline how you would embark on and complete a scoping literature review. Within this video, I hope to give you the tools to try and complete the literature review. I hope to outline the definitions and show you why you would use a scoping review, discuss the evolution of scoping review literature, outline the 6-step methodological framework, look at really how you can start the scoping review, go through each step and outline some practicalities. Within the literature there are a number of definitions. Colquhoun defines a scoping review as a form of knowledge synthesis that addresses an exploratory research question aimed at mapping key concepts and types of evidence to outline the gaps related to the defined area or field by systematically searching and selecting and synthesizing existing knowledge. So why should you use a scoping review? Well, a literature review is a form of secondary research where you're taking information that is already captured, usually by primary research. There are many different types of literature reviews and I'll not be able to go through all of them today, but what I will look at is the scoping review versus a systematic review. Within the literature, there are many different comparisons of the systematic review and the scoping review. Really, a systematic review looks at a very focused question, like the effectiveness of a treatment A versus treatment B on treating a certain illness. Usually, the protocol of a systematic review outlines what you will do a priori. Now, a protocol for a scoping review will outline what you can do, but because of the iterative nature of the review, then it can be modified as you go on. Within a systematic review, usually there's a quality check on each article that you include. Within the systematic review, usually it's quantitative data that you're looking at, but some do include qualitative data. Data extraction is normally quite detailed, and as I said, the question within a systematic review is the effectiveness of treatment A versus treatment B. It's usually quite clear-cut. Then to compare a scoping review, the topic that you're looking at within a scoping review is usually quite broad and exploratory, and this is why it lends itself to a lot of social sciences research and to a lot of educational research. The inclusion and exclusion criteria and the protocol, although it's set prior to commencing the review, it is yet flexible and it can be changed as you go along, modified post hoc. There isn't normally a quality assessment on each article that's included because that's really not the priority. Within the scoping review, you do take some quantitative data, but this is minimal and usually it's qualitative data that you're looking at. The scoping review doesn't aim to capture every single bit of evidence that's out there. It aims more to map what's out there and to identify gaps. It can be used as the initial review before embarking on further research, or it can be used as the entire research project. And usually within a scoping review, the question is a bit broader and a bit more exploratory. So, what is known about this? And when you're embarking on a scoping review, usually there's 3 things you have to consider. You need to consider the population, the concept, and the context. So the scoping review, it's quite new. One of the first articles that came out was in 2005, but from then, the number of scoping reviews that have been published has risen exponentially. And this is because of the usefulness of it. When you're going to embark looking at a topic that you're not familiar with, there's not much that has been written on it or published on it, and it hasn't really been explored very much before, then this is the type of review that you should use. Arkski and O'Malley published a paper in 2005, but other researchers and scholars have came along and said that really we needed a wee bit more detail because those who were reading scoping reviews weren't sure what this really meant. Other publications that you may like to look at would be Levac, Colquhoun and Joanna Briggs Institute Reviewer's Manual. For the purposes of this presentation, I would like to concentrate on the first 3 publications that I've stated. These publications have led to me creating this generic protocol that you can then use to form the basis of your review. So now I'd like to talk about the 6-step methodological framework. In short, number 1, defining the research question. Number 2, finding relevant articles. Number 3, study selection. Number 4, taking the data out of the articles. Number 5, collating and summarising, reporting the results. And number 6, the consultation exercise. For me, presenting this to you, you may just be embarking on this, you may be a novice. It's probably easier for me to explain what steps I took within my own research. I completed a project, a scoping review that looked at children's experiences of healthcare, and I used this as the basis for my master's dissertation. That was a master's in clinical education. So I'm going to take you through the steps. Step 1, so I was interested in what are children and young people's experience of healthcare. And the reason why I was interested in this is because not much was known about it, and a lot of articles that were published were from adults, namely parents and healthcare professionals. So this is my sort of starting point. Children and young people were my population. The concept was experience and the context was healthcare. So I went to Medline and completed a pilot search and went through all the 550 articles, and I ended up with 30 articles that I thought were relevant to my research question, to my topic and my purpose. And remember, my purpose was really to improve healthcare for children through their own experience. So after gathering these articles, I had a light bulb moment, and you'll find that when you're working through your scoping review, you will come upon these light bulb moments, and that's really the basis of your iterative refinements to what you're going to do next. Sometimes you have to take a step back and go back to step 1 to refine your research question, refine your search strategy. Going through these articles, I thought to myself, well, I really need to set down definitions here. I mean, what are children and young people? What age should they be? What is experience? What am I talking about? And what is healthcare? Does it have to be in hospital? Does it have to be in a health centre? Does it have to be when there's a healthcare professional there? I moved from the initial research question of what are children and young people's experience of healthcare, then to thinking about what are children and young people's experience of healthcare from their present perspective. And the added words there redefines sort of the inclusion and exclusion criteria. So from there is very important. I did not want to capture evidence from parents' voices or capture evidence from a healthcare professional's voices. I didn't want to know what the parent thought the child's experience was. I wanted to know what the child's experience was from their own perspective. Present is also relevant as well because within the literature, adults were commenting on their experience as a child, and sometimes this was 30, 40 years after. So I wanted to know what the children's experience were at that time. This then had further implications for the inclusion-exclusion criteria. So I moved on then to complete further searches, finalised my search, and then ran the search through Medline, Web of Science, Scopus, CINAHL, Embase. I came up with 994 articles. The databases that you select will depend on your topic. So that led me to gather 120 articles that were relevant. I had a number of articles that included adults and children, a number of articles that included parents and children and healthcare professionals. That gave me another light bulb moment, and I realised that actually the articles that included children as patients and adults as patients, they didn't really concentrate on presenting their findings of children. Most of the findings within them papers were from the adult patients rather than the children and young people. I decided, right, I will now exclude all papers that have adult patients within them. The other thing was, within the findings of each article, there would be findings that were written by the authors themselves, and there would be findings that were from the parents. Sometimes the authors would comment on the participants said or the participants thought. And I didn't want children and young people's experience that was amalgamated, as in the parent and the child thought this. I wanted their own experience. So that led me to think about taking the quotations out. And indeed, that's what I did. I decided I only wanted papers where they had children and young people's quotations within it. And that would give me a very rich data set for my qualitative analysis further on down the line. By taking these articles only, that led me to gather 89 articles where there were children and young people from the ages of 0 to 18 commenting on healthcare where they had direct contact with a healthcare professional and that there was children and young people's own quotations referenced to them themselves. So now I went to chart the data. And charting the data is when you go to each paper and you take out what's relevant and you take out what will target your aim and your objective, what you're really looking at. So most scoping reviews, you're going to take out the country that the paper was published from and the year, general sort of data. I also took out the age range of the children. And as well, I looked at the quotations and I completed qualitative analysis on 30 articles. Now, it was difficult for me because I had 89 articles, and usually with most scoping reviews, you might only end up with 20 or 50 articles. So it was a large number. Some of the papers within the scoping review do say that you can set a date when you will not include any more articles. Because I completed this for a master's dissertation, then it wasn't possible for me to analyse all 89. So I ended up taking out the quotations from only 30 articles, and this is acknowledged as a limitation. This led me to present the findings within my master's dissertation, which you can access on ResearchGate. So how will you start embarking on your scoping review? Well, I would suggest construct a research protocol of intent, and this is what you are going to do. So even if you're not sure, it doesn't matter, just put down pen to paper how many reviews you're going to have, what databases you're going to go through, and as you go on and as you learn a wee bit more about your topic, you might decide to change this, and this is your iterative refinements, and that's okay. When you're setting a protocol, obviously you have to acknowledge your limitations. So if you're completing a master's, there might only be yourself as the lead researcher. You'll obviously have a supervisor, but there mightn't be any more people on the research team. So variances, as I described in my master's, are planned activities which differ from that which is recommended. And I have set here within this generic protocol in the slides to follow what I feel is recommended from the first 3 articles that I mentioned. When you do complete your scoping review and you put it within your dissertation and submit it, it's best within the dissertation to comment on non-adherence to a protocol. As researchers, we're embarking on researching a topic. We try and do this as best we can, but there are difficulties along the way, and non-adherence to your protocol as you set out to do may be expected. Let's go to step 1. This is, I feel, the most important step, and this is identifying the research question. When you're identifying the research question, you really have to define a question by combining a broad question with a specific context of inquiry. So this is looking at your population, your concept, and your context. And try and put pen to paper, really get down what you mean by these. Try and be quite specific. When you are putting down your research question, you always have to think of the rationale for conducting the study and then specify as well the purpose of the study. A lot of research is done because, well, that would be interesting to know, that would be really interesting to do, but maybe there's a paper out there that has already looked at this evidence. Maybe there's a paper out there that's already sort of concluded what you're trying to find out. Really think, how will this help? How will your research be of benefit? How will it have impact? You also need to look at what outputs you want from the study. So within my study, I wanted children and young people's voices within their quotations, and that was the outputs. You also have to review and consider refining the research question, including the terms within it, as you've defined, after the piloting process and after identifying relevant articles. So the next stage is identifying relevant articles, and hopefully you'll not have to go to the library and plod through a lot of books. Usually a lot of searching now is done on databases, so it's very important to seek advice and guidance from your subject librarian. So as you see on the left hand side, this is the generic protocol that I mentioned, and on the right hand side, this is the possible variances that you may have. After getting advice from a librarian, you also have to think, well, what is your experience of completing a scoping review? And the literature does say that researchers need to have some experience in completing a scoping review, but if you're a novice, you can't help it. So that might be a variance for you, that you don't have much experience doing this. Your supervisor might have some experience. Also, I think it's very important to do the piloting exercise, and my piloting exercise, I gathered 550 articles and ended up having 30 relevant articles. This then has implications for your research question, your search strategy, and your definitions. Also, you need to, as I said, modify their search strategy. And if you feel as if you're going through completing your scoping review and you haven't modified your research question and you haven't modified your search strategy, then you need to think why you haven't done that. If you are limiting your scope and you're narrowing in on a specific thing within your topic, then you need to acknowledge the limitations of this and you need to acknowledge why you're doing it. Then once you've got your final version of your search strategy, you need to run the search on your primary database. Other databases have different functionality, so you'll not be able to just copy and paste. Your librarian will help you with running your primary search through the other databases to gather all the articles. You may consider searching the internet for relevant articles. You may consider searching relevant networks and organisations. And you will be able to add any that were previously known to you as well. You may consider including grey literature, which are like white papers, conference proceedings and theses. This does take a lot of time, so you need to think how this is going to help your research. You might consider hand searching relevant journals, and you might consider hand searching the reference lists of the relevant articles. But for each thing you do, you need to consider, why am I doing it? Because every step takes a lot of time. Once you've got all your articles, you need to import these onto a reference manager. This could be Mendeley or some other reference manager. And you need to exclude the duplicates. A lot of reference managers will exclude these for you, but a lot of the time there are some that you need to do manually. For the variances I've listed on the right hand side, this could be that you don't have much experience in it. This could be that you decide not to include grey literature, and this could be that you decide not to hand search. So now we move on to stage 3, which is study selection. This is when you've got all your articles. This could be maybe 1,000 articles, and you're going to select the ones that are relevant to your research question and that really answer your research question. So you need to decide on an inclusion and exclusion criteria, and you need to decide on this before you go through your articles. But because of the iterative nature of a scoping review, this can be modified and you can include further detail as you go along. You might decide to set a deadline for which no more studies would be included, and you might decide to use 2 reviewers. It might be difficult for you if you're completing this as a master's to have 2 reviewers. Not many supervisors would go through 1,000 articles, but they might decide that they can, and that's good. If your supervisor is unable to go through all the articles, then you might consider pairing up with someone else who's doing a similar exercise. They can look at your articles and review them, and you can look at theirs. Now, a second reviewer isn't always needed, but in a lot of recent publications, and indeed in the Joanna Briggs manual, they have said that it is necessary to have 2 reviewers. But there are arguments for and against. You also need to acknowledge the iterative nature of the review, and when you're stipulating your inclusion-exclusion criteria, you really need to have that beside you when you're going through the articles time and time again, and always looking, should this be included, and if not, why, and update your criteria as you go on. Then, after going through a number of articles, you do need to meet up with your supervisor and think, right, am I really answering the research question? Do I need to change the research question? Do I need to refine the search strategy? And that'll help progress your review. If an inclusion of an article is questionable, then you need to review this article with maybe the second reviewer or your supervisor or both. If there is a disagreement, then it is valuable to have a third viewer's opinion if that's an option for you. After going through all the articles and including and excluding, you then need to present this information on a Prisma flowchart. For the articles that you have reviewed, you need to stipulate, really for the articles that you've excluded, you need to stipulate why you have excluded these. So variances here might be that you don't have a second reviewer, might be that you don't think it's necessary to set a deadline where no other articles are to be included, and you might decide to meet with another researcher as well as your supervisor. So step 4 is charting the data, and this is where you're going to extract the information. Within the literature, it talks about a data charting form. That sounds as if it's a physical form, so it may be that you decide to use a physical form. I used Excel. So once you've constructed the data charting form with your supervisor, then you need to extract information from what's recommended, which is 10 studies, and then go back over it. After going back over it, you might decide to refine the form. You might decide, well, this isn't really needed and it's not aligned with the aim and the purpose of the research. Or you might decide to include other things within the form. What is recommended is 2 reviewers as well at this stage, but this could be a variance for you because you don't have 2 reviewers, so it just depends. After setting your form, then you need to take all the data that's required out of each article, go through each article and capture it. So now we move on to step 5, which is analysis, collating, summarising and reporting the results. Stage 1 of this analysis, you should complete basic numerical analysis, and this is usually done on an Excel spreadsheet. It's not normally anything more than that. And the reason for doing this is just to show the extent, the nature and the distribution of studies. So usually what would be captured would be the year of publication, the countries of origin, the number of participants, maybe the ages, and whatever you feel is relevant to your readers that may be looking at your final results. You also need to complete qualitative content analysis, and usually this is basic thematic analysis. Then stage 2, reporting your results and producing the outcomes, and always look back at your overall research question and at your aims and objectives to ensure that these are answered. Stage 3 then, you need to consider what is the meaning of the findings, how do they relate to the overall purpose of the research, and what's the implications then for future research, practice and policy. Step 6 is the consultation exercise, and not a lot of scoping reviews actually complete this exercise, or if they do complete it, sometimes it's published separately. And the reason for this is a scoping review, steps 1 to 5, is an enormous bit of work. To then go and complete a focus group, which would take submission for ethics, then is an additional amount of work. However, Levac says that the consultation exercise is essential. If you are going to embark on the consultation exercise, you need to establish what is the purpose of this exercise. Within the literature, they say that you're going to take the themes to the stakeholders, and that could be the primary population that you were looking at, or it could be another group that you feel is affected by your research. Before you do this, you need to compile your preliminary findings, and this is used as the foundation to inform really the content of what you're going to talk about within the consultation exercise. You need to think about who I'm going to include in this consultation exercise, or it might be a variety of participants from a variety of populations. You need to outline how the data is going to be collected and analysed. This could be by audio recording, which is then transcribed. And you need to consider incorporating opportunities for knowledge transfer. So this is when you're able to sort of educate, in a way, the participants within your consultation exercise, which might be aligned with the purpose of your research. The last step is then to complete the consultation exercise and analyse your data. We've been through the 6 steps within scoping review methodology. From my experience of completing a scoping review, I would say that, above all, it takes time. Usually scoping reviews are completed within 3 months if there's a full-time researcher working on it. So a full-time researcher doing about 40 hours a week. If you're a part-time researcher, and by that I mean you're maybe doing about 16 hours a week, then I would say it would take 6 months. One of the big things that you need to consider is just talking to people, and it was very difficult for me to verbalise my initial thoughts because you're afraid of criticism from others. But it doesn't matter if you're criticised, and talking really helps. So, as I said, talk to people that you see every day, talk to people at home, or if there's someone that's leading the research within the field that you're looking at, then talk to them. Because possibly you're completing this on a part-time basis and you're coming in and out of your work, then you need to keep a journal, and I think this is very valuable because you have a lot of thoughts and have a lot of reflections and a lot of considerations, and a week later when you come back to your desk and try and pick up where you left off, it'll take some time to pick up a wee bit of momentum. So keeping a journal or a research diary is really important. When you're writing your dissertation, if that's what you're doing, or maybe you're writing a paper, after you complete the last sentence, it might be good to jot down a few bullet points of what you think you should write next, and that'll help with the flow. Try and keep organised. For this, I used Microsoft Office applications.
I found OneNote 2016 really handy, where I could include links and screenshots of my search strategies and citation lists.
Here's a list of my references. These are only some of the references, and there will be further references available searching through the databases, or if you want to look up my Scoping Review workbook. And you can access this from ResearchGate just by request. If you just send me a request, I'll send it on to you. You can also look up my master's dissertation, and that'll show you maybe how to write out your review. Finally, I just want to say thank you for listening. And although this sounds at this stage an enormous amount of work, it is really enjoyable, so it's important that you enjoy it. Thank you.